proposed therapy cuts under Medicaid. Health leaders mourn public funding cuts, plus Governor Braun's helicopter trips and more. From the television studios at WFYI, it's Indiana Week in Review for the week ending August 22nd, 2025.
Indiana Week in Review is produced by WFYI in association with Indiana Public Broadcasting Stations.
This week, people with disabilities could face significant cuts to therapy services if Indiana's proposed changes to Medicaid waivers are approved. WFYI's Ben Thorpe reports lawmakers and advocates gathered recently at the State House to oppose the reductions.
The state is proposing changes that would cap music and recreational therapy services to just 6 hours a month. Advocates say that is a significant cut to the time that gets people out in the community, doing things like going bowling, going out to eat, or playing music. Kendra Hummer has cerebral palsy. She says the waiver has helped her feel less alone.
If these changes go through, it will be devastating for me and my entire community.
The state has 30 days to review public comments before submitting the changes to the Centers for Medicare and Medicaid Services for approval. If approved, it would take effect next year.
Is the state cutting too much to fix its budget woes? It's the first question for our Indiana Week in Review panel. Democrat Ann DeLaney, Republican Mike O'Brien, John Schwantes, host of Indiana Lawmakers, and Oseye Boyd, editor-in-chief of Mirror Indy. I'm Indiana Public Broadcasting State House Bureau Chief Brandon Smith. Mike O'Brien, is the state cutting back too much?
Well, I think what they're trying to do is preserve the core services that have to be provided to the population that needs it most: kids, pregnant moms, and the elderly, and the disabled. So they're looking for places, at least here, where Indiana's an outlier in the services that are provided. So for these types of therapy services, only 6 states in the country do this, and 5 of the 6, including now Indiana, put limitations on it and put caps on it. And so that's what's happened here. It's not been completely taken away. Of course, they'd want to provide more if they could. It's not the price of bowling shoes, renting bowling shoes that drives the cost of it, though. It's the providers and the other support systems that are around it. So it is significant, but it's in the interest of preserving the existing program, right, and the most essential services at a time when there's budget uncertainty here. The program's never been bigger. Healthcare costs have never been more expensive, and we don't know what the feds are going to hand down to us too. So all those factors are in play are not great, and cutting these services isn't great. But right-sizing that, but it is starting to affect, as we always talked about, other parts of the budget, K-12 education and other priorities, and so you got to make hard decisions with that.
Is this simply a budget reality for Indiana?
It's not a budget reality, it's a choice, okay? They are still cutting corporate taxes, they're still cutting income taxes, they're still giving vouchers to people who don't need them for private school education, and in fact, they're expanding that. So it's a choice. It isn't simply that there's no alternative. There are alternatives. The Republicans just don't like the alternatives. They'd rather give to the rich and take from the more vulnerable, which is what this is, and we're gonna lose hundreds of thousands of people off Medicaid by the time the Republicans in Washington get done. It's going to be a disaster for Indiana because so many people in Indiana receive Medicaid services, and that's going to drive up the cost of health care for everybody else because they're going to go to emergency rooms, and the costs are going to be passed on to the people with insurance. And that's a choice Republicans are making, and don't make it anything other than a choice.
This is always the problem with trying to address a budget problem through Medicaid, right? Which is, no matter what you cut, there is going to be a it's a difficult story to tell, right?
Yeah, I think it's a matter of priorities. We do have to fix the budget. We do have to figure out Medicaid and what's going on with Medicaid. But I think part of the problem is, and I keep saying this over and over because it rings true for me, is that when you look at Medicaid, we also need to look at the whole health system in general and the high cost of health care and where Indiana ranks in health outcomes poorly. So therefore, we're going to always have higher costs of anything when it comes to medical care. So how do we fix that? Well, we keep fixing it by saying we're going to cut here, but we never really look at the very beginning of the process. How do we become better as a state in general? I know I'm jumping ahead of us a little bit because we're going to talk about some other things. But all these things to me just all go together. And when we're talking about we keep cutting the budget, fixing the budget on the backs of the most needy. I know you're saying it's an outlier, but we need to be an outlier when we're doing the right thing sometimes. Just because we're one of 6 states, we should be proud to be one of 6 states when we're doing something that actually helps our Hoosiers, helps our residents live better lives. And that's what this is really about, is living better lives. Like as we heard in the introduction, how it harms the community. People feel alone. So how do we help people to, not feel alone? If you're one person who's dealing with medical issues, you also need to be around community. You need to have a social life. All these things are important for quality of life.
This reminds me exactly of the attendant care issue, which is, it's one of those things where the state had been offering this thing. In this case, it's these therapy services without limitations. In the case of attendant care, it was family caregivers being allowed to care for their medically complex children at higher reimbursement rates. And so what the state said is, we're not going to get rid of it entirely. We're not going to stop you from doing this entirely, but we need to try and rein in our costs, so we're going to, on the attendant care thing, reimburse you for less. On this, we're going to put a cap on it per month. Anytime you're taking back something people had already been getting, are you running into trouble?
Sure, I think that's the one certainty in our ever-changing political system, is that once people have benefits that they have grown accustomed to, it is hard to take those away. We've seen it time and time again. And I would say, let's take this discussion and clip it, note to the control room, and save it, because it's going to have a very long shelf life, I think. Yeah. This is going to be a discussion that comes up again and again and again, because this is just, whether you call it the outlier or something, these are the easy cuts, arguably. I'm not saying they're easy for the people who are affected, but in the scheme of things. But you're talking about, according to the Congressional Budget Office, possibly $1 trillion in Medicaid cuts nationally over the next decade. And don't forget, we're partners with the federal government. And when the federal government cuts funding, guess who has to shoulder the responsibility? It's make cuts. Yeah. And I think the temptation is to think that Medicaid is helping somebody else. It's some small population of pregnant women or needy children. Well, actually, I just looked at the newest numbers. 26 of every 100 Hoosiers are enrolled in Medicaid, which is above the national average of 23 per 100. So when you talk about, statistically, one of us at this table, or more than one, is enrolled, it's not just some other population. So I think as we see more cuts affecting not just recreational outings, but fundamental care, this will almost seem quaint in comparison.
Earlier this year, Indiana lawmakers significantly cut public health funding in response to the bleak budget forecast. And Indiana Public Broadcasting's Abigail Ruman, in their final report for us, says that healthcare leaders say the loss of funding will likely slow efforts to address healthcare costs and outcomes.
Indiana's historic public health funding was scaled back in the final version of the state budget, dropping from $100 million to just $40 million for all 92 counties. Mike Schroyer is the president of Baptist Health Floyd in southern Indiana. To address high healthcare costs, Schroyer says the state needs to invest more in chronic disease prevention and public health.
And unfortunately, in this last legislative session, they decreased the funding for public health. So we kind of went in the wrong direction in that way.
90% of the country's healthcare expenditures are for people with chronic and mental health conditions. Schroyer says Indiana's population ranks poorly in most health outcomes, which means people are more likely to have and develop chronic conditions.
Ann DeLaney, state lawmakers were not opposed to the public health funding program at all. And so they indicated a willingness to continue the program as much as possible. So if lawmakers can come back in the next state budget, and God willing it's a lot better than this last state budget was, if they boost the funding then, will that help mitigate any temporary setback we see here?
If they're the gutless wonders I expect them to be, they can come back for the special session and fix this.
Well, maybe we can add to the list.
That list of special session desires is growing longer.
Well, why not? These are more real problems than redistricting is, certainly. And I don't know whether they can undo the damage they do. When they do this stop-start, and people are reluctant, obviously, to rely on an allocation because it can be ripped back right when you start laying the foundation for spending the money. And to go to the point Oseye was making earlier, this is This is exactly the wrong approach. We know we have an unhealthy population. We know our health care costs are too high. This is designed to help in that regard, to identify potentially chronic illnesses earlier and treat them in a much less expensive way. And what do? We cut it. I mean, it is the senseless kind of approach that legislature always takes on these cases.
I mean, this is something, too, that Governor Mike Braun is really behind. He loves focusing on preventative care instead of treating, illness later, because it's a lot cheaper on the front end than on the back end. So is this something that can and should get a boost if the budget situation improves?
I think it can. I went back and looked at that Senate Bill 4 back in 2023, and it had the entire Democratic caucus in both chambers and large percentages of the Republican as co-authors.
Yeah.
So you try to, if you think, okay, well, if the funding comes back, what do we do? One, they tried to resize it to what programs have you already put in place? What money are you already spending? We're going to fund that. The next, phase 3, hold on a second, right? And that was that. So it was a cut, and that the anticipated spend went down, but it wasn't cutting anything that they were already doing. Was the goal. So if it comes back, and the governor, like Governor Holcomb, took a lead, right? And it was an unusual time for a Republican governor to take a lead in public health, too.
Yeah.
If you remember the context, we were coming right out of COVID. Mm-hmm. You had Republican governors all over the country taking punitive measures to cut especially local public health. So it was a pretty extraordinary effort back when they did it. And it's going to take leadership, and it's going to take champions in the legislature to try to pick it up and put it back to where it was.
This is another one. It harkens back to the question I just asked you in the last topic. So let's say I agree. I think there are a lot of voices in the General Assembly, and I think even Governor Braun has talked about this as an example of what we should be focusing on. So there will be voices who say, if the budget situation is better, let's grow that so we can do more of that. But then you fall into the trap of, if it's the first thing on the chopping block when the budget gets tight again, how can anybody?
There's a lot of that chopping block.
Well, there was.
They didn't just look at public health and go,
this year there was quite
Not
a.
vouchers.
Believe me, I'm well aware there was a lot on the chopping block.
Well, if you take that to the extreme, government wouldn't do anything. Why repair a road? Because you'll get accustomed to being able to drive from point A to point B without your wheels falling off. I mean, at some point you do have to invest, even if there is a risk, as there is with everything, that funding may tighten in the future. I think Mike makes a good point about this not being, I wouldn't break this down as an R versus D issue. It's clearly not. In fact, if you look at the task force that's been a couple years looking into public health in Indiana, which had been overlooked for probably a century in many ways. I want to say that there were a lot of prominent Republicans. I think Luke Kenley, former state senator, was involved in that. And then you look at people who actually authored the bill. I think it was Mike Crider, Senator, could be, and others.
And Charbonneau.
And Ed Charbonneau. I'm not going to leave Ed out. But Republicans. And they were adamant and vocal about seeing this. So if anything gets additional funding when things grow rosier, and we hope they do, I think this is at the front of the line.
As long as it doesn't interfere with vouchers and tax cuts.
Mike Crider is the one in the Senate who's taking the lead on mental health services.
Mental health.
But,
all health is good health.
Yes.
But I will always say, and I'm only half facetious about this, as long as we call it public health, there will be enemies, because people, it conjures up notion of something else. Call it anti-drug, pro-pregnancy, and all of a sudden, it has a different feel for it.
And mentioned this already, but it gets exactly to what you were talking about in the last topic, which is, if we need to, all of the problems in healthcare that we talk about in this state, not that high healthcare costs are unique to Indiana, but Indiana has some of the worst. All of this gets back to, if we can make the state healthier at a core, everything else gets easier, right?
Mm-hmm. Yeah, I mean, we've been talking about obesity and Indiana's health crisis for a long time. And we're finally moving into the direction of doing something, and then we get the cuts. I understand that things have to be cut. You have to figure out where to cut. To your point, not vouchers. I didn't want you to say it before I said it, so not vouchers. But things had to be cut. I mean, I feel like legislators had to make some tough decisions. We know they did, and this was probably one of the tougher ones. But when we look at where we want to be in Indiana in the future, we want to be healthier. We need to be healthier for Indiana's sake, not just because it's economically better for us to be healthy than unhealthy, because the costs are so high, astronomical rather. But hopefully we do get back to putting this back on the table and putting some more money back into it, because we were just beginning to see gains.
All right, the Indiana Capitol Chronicle reported this week that Governor Mike Braun has taken 11 helicopter flights to and from his home in Jasper in the last 6 months. The Capitol Chronicle story details that the flights on the Indiana State Police helicopter cost taxpayers nearly $24,000. But the Braun administration argues that cost would exist anyway, because pilots must fly a certain number of hours each week under both Federal Aviation Administration and state police standards. The Braun family home in Jasper received a security upgrade earlier this year, including a $1,700 helipad. Oseye, is this really that much of an issue?
Depends on who you ask. It depends on who you ask. As a journalist, I'm always interested in how taxpayer dollars are being spent. I understand the rationalization here, the spin of where they're going to have to fly anyway, so why not take the governor where he needs to go? But I don't remember past governors building a helipad.
Well, past governors largely either lived entirely in the governor's residence or nearby, in the case of Mitch Daniels.
So, well, we have a residence here in the city, am I correct?
Yep.
So that was built for governors to actually live there, no matter where you're from in the state, you have a place. So I think I made my point there that he could actually live in Indianapolis and he wouldn't need a helicopter at all. But I think, though, it seems when we're talking about cutting, we're talking about making cuts in Medicaid and public health. We're talking about all these different things except for vouchers. It looks a little bit like a luxury. So I think it's more about the optics. And if you're asking us to cut here, but then you're riding around in a helicopter, I don't think it's a good look.
Yeah, 2 years ago, when we couldn't spend money fast enough in that state budget, in part because of a huge influx of federal funding and all that, this feels like a completely non-story. Is it because it's in the shadow of the current budget that it feels more of an issue?
Sure, when dollars are tight, these kinds of things get attention, and it's a legitimate story. To your point, I think the public has a right to know how their tax dollars are spent. However, I will say there's not the hypocrisy issue here that sometimes comes up with these kinds of stories. As far as I know, Governor Braun never attacked the use of helicopters or pledged not to. And I compare that,
because they all use them.
I compare that with back to a campaign that Ann ran when Evan Bayh's successful bid for governor, where he had awarded a golden faucet, sort of a take on the golden fleece, to Bob Orr, his predecessor, for flying around on this supposedly beautifully tricked out, equipped Beach King Air, and made hay out of it politically. And then I went back and looked after about 6 months into the Bayh administration. I don't remember the exact number. And guess who'd used it more than Bob Orr had? It was Evan Bayh.
He got rid of it, too.
Probably after that story. But,
I think you're giving yourself more credit.
Well, but that, to me, when politicians act in a manner that departs from what they have said or displays hypocrisy, I think that moves it to a different level. Having said that, I hope the public pays attention to every expenditure because it's their money.
I mean, $24,000 is a lot to me in my personal finances, but when you're talking about the state's coffers, it's a drop and a drop and a drop in a bucket kind of thing, right?
Well, the only thing I learned in the story is how cheap it is to fly in a helicopter. I thought it was going to be $20,000 a trip.
No.
And the helipad's hilarious. That was in a field where he cut the grass himself, and they dumped a bunch of rocks in a circle. That's where it lands. This isn't like some, he's landing on top of a skyscraper in Jasper.
Not a ton of skyscrapers in Jasper.
I think the state police did it the right way. They got to get the hours on this helicopter anyway. So why not just manage it so we can do these trips? It's 11 trips in 8 months.
I was just going to say 11 trips in the last 6 months. That doesn't feel like an excessive amount.
I don't think it's the kind of story that makes the difference in an election. But I think Oseye is right that when you're talking about that child with cerebral palsy not getting the kinds of services she wants, it just doesn't play well.
Yeah. So it's more of an optics problem.
And the more he should have waited until they were cash rich to do it, and then nobody probably would have even noticed.
Yeah. All right, time now for viewer feedback. Each week we post an unscientific online poll question. And this week's question is, are Governor Mike Braun's helicopter trips to his home in Jasper a problem? A, yes, or B, no. Last week we asked you whether Indiana's latest iRead scores show that the state's focus on literacy is making a difference. 67% of you say yes, 33% say no. I'd say the no's a little high there. If you'd like to take part in the poll, go to WFYI.org/IWIR and look for the poll. Well, Indiana, speaking of health care again, Indiana ranks 11th highest in the nation for the number of residents with medical debt in collections, according to the Urban Institute. And state lawmakers, leaders, and advocates took a first step this week in exploring the issue of medical debt and potential solutions. Advocates say Hoosiers have an estimated $2.2 billion of medical debt in collections, and they say that debt causes people to delay or forego care and strains their ability to pay for other necessities. Dave Almeida is with the Leukemia and Lymphoma Society. He says part of the solution is better education about billing appeals, payment plan options, and charitable support. Almeida says Indiana lawmakers should also address what he calls egregious collection practices,
such as the seizure of a primary residence or a primary vehicle, or the seizure of income through wage garnishment, and capping interest rates on outstanding balances.
But collection industry leaders like Heather Gilb say wage garnishments and liens are what ensure debt collection is possible.
The better solution is to preserve reasonable collection tools while ensuring that the safeguards already in place are promoted, understood, and used to their fullest potential.
Gilb says an example of those safeguards is the existing cap on wage garnishment that limits it to between 10 and 25% of a person's take-home pay. John Schwantes, with the political realities of Indiana, is there an achievable solution in the legislature that can make a difference on medical debt in Indiana?
Well, with your caveat of referring to political realities, I guess universal health care is out the window?
Probably.
Okay, because universal health care would solve the problem. This problem. Maybe create others.
Probably would exacerbate the Medicaid.
But
that's why my qualifier was achievable.
Yes, so not solution. Achievable there. You look at what other states have tried. You look at what the federal government done. The ill-fated Consumer Financial Protection Bureau in the waning days of the previous administration had put forth a rule that would have prevented debt from going on your credit record. And a judge subsequently, just recently, struck that down, said, And other states, though, have, I don't know who's enacted it, but other states have looked at state level provisions along those lines. The idea being that if you're already drowning in debt and it shows up on your credit report, well, then your attempt to get a car to get to work so you can get a job to pay the debt or to live in a place that's within a reasonable distance from your workplace, et cetera, that doesn't happen. So then you spiral and it just gets worse and worse. But political realities, that ain't going to happen either in this state. So no, there is no answer.
I don't know. This has gotten traction.
Well, yeah. So this was the reason this is a study committee. So the way the study committee process works is the 4 legislative caucus leaders vote on the topics that they're going to study each year. And in order to be on the list of topics, 3 of the 4 caucus leaders at least 3 of the 4 caucus leaders have to agree to study it. This was in part a letter that House Speaker Todd Houston sent to himself, I guess, to say, hey, we need to study this. So is there growing bipartisan momentum for something to happen here?
Oh, I definitely think so. In this day and age, when we're seeing so much medical debt, going back to the fact that we're in an unhealthy state, and then we have poor health outcomes.
You really got a message. Whole show.
We are in the hospital a lot, and when you think about, there are ways to actually address the debt, as the woman in the story said. You can create a health plan, a payment plan. All these people don't know that people do not know there's financial assistance. People do not know that you can create a health plan, a payment plan. And when you get those collection calls, you kind of feel pressured to go ahead and make the plan to whatever number they say versus what you can actually afford. And then when you miss those payments, you're in debt even more. So it becomes a thing where you want to lean against your house, or how are you going to pay for this? It becomes scary for people. That's why they don't answer the phone calls. That's why they don't know because it's scary. It's a very scary thing, and they're probably still, a lot of them are still sick. You know, when you're still getting treatments for cancer, you don't really care about the bill.
A phrase that was brought up in the committee discussion, the study committee discussion earlier this week, was personal responsibility. And I think, you know, when we talk about like student loan forgiveness, a lot of the Republican resistance to that is these people chose to take on that debt. They chose to go to college. They had other options. Not a lot of choices if you suddenly there's not a lot of personal responsibility involved when you get cancer.
You know, I take issue also with the student loan comment. the government guarantees for-profit institutions as well, and they make a business of seeking out people who are more vulnerable and promising them the moon and starting interest rate on the student loan debt on the day they enroll.
But medical debt even more so.
Medical debt you don't have control over, and not only don't you have control over, the odds are good you're going to lose your job. So whatever ability you had to go on a payment schedule or do something is gone, which is part of the reason that bankruptcies, Chapter 13 bankruptcies in Indiana are up dramatically. And so the two combined forces are student loan debt and medical debt.
Does it feel like there's growing bipartisan momentum here?
Well, yeah, and I think if you combine what the legislature's already done, in large part driven by Republicans, the two-sided argument, you got to hit it from both sides. You've got medical debt that, what do I do with this debt? How do I get out of this debt?
Right.
How did I get into this debt?
Right.
Medical debt itself is confounding because you don't know you're getting into it until you're in it.
Well,
large times, which is why the legislature's focus on transparency.
That's all good, but what happens when Medicaid, when people get cut, when we lose 200,000 or 300,000 people, that number's going to go way up.
Be discharged? I don't know the Oseye
Yes.
industry. It can be. All right. Unlike student loan debt.
That's
Unlike
Indiana Week in
student loan debt.
Review for this week. Our panel is Democrat Ann DeLaney, Republican Mike O'Brien, John Schwantes of Indiana Lawmakers, and Oseye Boyd of Mirror Indy. You can find Indiana Week in Review's podcast and episodes at WFYI.org/IWIR or on the PBS app. I'm Brandon Smith of Indiana Public Broadcasting. Join us next time because a lot can happen in an Indiana week. The views expressed are solely those of the panelists.
Indiana Week in Review is produced by WFYI in association with Indiana Public Broadcasting Stations.